Hey, thank you so much for being part of the Innovative Child Therapy Symposium. I'm super excited to have you on. You're a fellow podcaster and you are amazing at what you do. So let me have you introduce yourself, tell people who you are and what you do.
Awesome. Well, thank you so much for having me. I'm really excited about what you're putting together. This is going to be such a great resource for so many people. I am a music therapist, and I'm actually in the process of getting my LPC. I'm in Colorado. So I specialize working with children, and definitely I'd say like half and half. Half of my caseload is working with children with developmental disabilities, developmental differences. And then the other part of my caseload is working with children who have a life-limiting illness. So sometimes medical trauma, end of life or palliative care for some children. And so that mental health piece is really important for me. So I've kind of dabbled a little bit more on the mental health side and bridge it into music therapy.
Beautiful.
Yeah.
Such
Yeah.
meaningful work, but such unique work.
It's incredibly humbling. I consistently go to work, spend time with kids, and it catches me off guard in session, sometimes out of session, where it's like, wow, it's intense, but it's really beautiful.
Mm, mm.
Yeah.
Now, I'd like to distinguish between music therapy techniques, which I
Hmm.
think a lot of us child therapists, play therapists may do, or we can do, in the actual, position of music therapist.
Yes. So to become a music therapist, you need at least a bachelor's degree with an extensive internship. Our internships are about 1,200 hours.
Ooh.
And most, if you don't have, like I went a different route of becoming a music therapist where I went back and did an equivalency program and then got my master's in music therapy. So it's extensive training. And to be a board certified music therapist or MTVC, you need to go back, you need to have that significant amount of training.
Mhm.
And within that, you definitely learn, and it's one of those things with distinguishing using music in a session. I always think of like auxiliary music in a session as a great way, like those music therapy techniques or music techniques that can be utilized by everybody. You know, as music therapists, we want everybody to use music.
Yeah.
We know the power of it, and it's amazing. And I think there's those music therapy interventions that require a music therapist. I would imagine, especially with play, it's that place where you really start to dive deep into the medium that requires a music therapist. So if, for example, I was going to talk about some of these too, of some interventions that I know like social workers use are like making lifetime music CDs where it's so cool. And it was another music therapist who told me about that one. Her name is Oksana Kavaliova. And, you find these songs that kind of match these different time periods in your life. And it's incredibly therapeutic and you get so much information from that. But you don't have to be a music therapist to do that you're really just talking with somebody, gathering information. I think that's a great example of a music technique to use that so many people can use. And then there's that other side of,
Hey, with that one,
yeah.
like as far as like practical application, it sounds like maybe you would kind of sit down and kind of go through the client like a timeline, be like, let's think about in
Yes.
your 20s, what's a song that really kind of resonated with you or something like that? Is that what it's about?
Absolutely. Yes. And I think even with kids, I've done this a lot with adolescents too. Um, because sometimes playing music for adolescents, it can kind of be like I'm too cool for that kind of thing. So
Yeah.
then we might eventually get there, but those soundtracks of important songs that represent different
Mhm.
periods in time. And even with younger kids, it's funny to hear their responses and what they pick. I know like right now, probably so many children would talk about the new Frozen song because that just came out in the movie. It's like I've been hearing everyone sing it everywhere.
Yeah.
So cute. But yeah, it can be incredibly powerful to gain that information. And then as a therapist, whether it's in session or out of session, sometimes you can do that with a client, is looking at the lyrics and, what do these lyrics say? Why is it important to you? And I feel like it's such a verbal intervention that, having that mental health training it's just a great way to plug in music into a mental health type of session.
Absolutely. My first
Yeah.
exposure to it was actually in an expressive arts class,
Hmm.
and she brought in some music therapists from a local hospital, and
Yeah.
she played, or they played, Bridge Over Troubled Water, and then we actually did some artwork while we were listening to it, and it was profound. I mean, there was
Yes.
like a visceral sensation that came
Hmm.
from just listening, and then applying your own situation to what the meaning of the lyrics meant to the person listening. It was
Yeah.
incredible, and I've heard that song a million times, and
I love
I've
that
never
song.
had that experience like I had in that setting.
Yeah, and that's I think a great example of how powerful music can be, especially if you accompany it with something like art, and it becomes this really multimodal experience where it's not, I don't want to say just art because I'm not, but it's not art in itself, but then you also have this auditory piece that you're bringing in. And yeah, it can be so powerful. That is another great example of like a music technique that you could use.
Mhm.
And I think where it could start to get in the line of, music therapy or requiring support of a music therapist, whether that's consulting or co-treating or something, is when you're really like analyzing those musical elements and like the really intense songwriting kind of elements, and sometimes with actively playing different things, a music therapist might have a lot more knowledge of how the music can trigger certain things.
Mm.
There's certain chords that can make you feel kind of certain things. We use those in a somewhat manipulative way in a certain. Oh, go ahead.
That is so interesting. So, like, the
Yeah.
chords can actually evoke certain emotions or help
Yes.
people. I'm thinking about like the window of tolerance when people are like either hyper aroused or hypo aroused. They're
Yes.
like hypo aroused. You're saying you can use music to kind of pull them to a certain space where they can get different work done.
Totally. And the big thing too is that that musical knowledge of how music works. As music therapists, we have to take music theory and all of this kind of stuff of understanding how that works.
Mm.
And there's kind of like those general guidelines that we know how music may stimulate or move somebody from one place to another. The ISO principle is a great example of that, where I did this with an observation with a woman. She was a hospice music therapist, and it was with an older client, but we came in and the older client was just extremely agitated and shaky and very constricted with her body. And the therapist played music where that client was at. So, faster. I think she was strumming with a pick. But what she did was, over probably about a 20-minute window, was she just chained all these songs together. She never stopped playing.
Mm.
And she slowly went from, kind of faster music and brought it down to, 60 BPMs, which is
Mhm.
that slow where really relaxing. And the woman matched with that. And then that's where it brought her to that place. And just like you're speaking on, we just connect with music like that. And there's ways to manipulate that to move it into a certain direction.
Ooh, it sounds like attunement at a really deep level.
Exactly.
So much
Yes.
where it can change your heart rate and your blood
Hmm.
pressure. That's incredible.
Yeah, it's really, I remember I think I cried after that one. I was like, whoa, like it was really intense and beautiful to be a part of, to see.
Oh my goodness. Now,
Yeah.
I heard a partial story before about music therapy, a music therapist working in the NICU, but I just heard like parts of it, and I'm thinking about, based on what you just said about how music can affect your heart rate. The little babies are so vulnerable, and so
So
sometimes
much.
they're really unstable in terms of
Mhm.
like their heart rate and all
Yeah.
the readings there.
And it is a very big, it's like a subset of music therapy that you can get trained in is NICU music therapy, but it's an extensive, a really extensive training to go through because of how vulnerable and how much music can be damaging, the potential that music could damage, of being aware of that as a music therapist, of the auditory level. I think I've heard people say it comes down to like the type of guitar and strings that you're using. There's all of these different elements that go into it. But yeah, you can get specific training for NICU music therapy. Yeah.
When you say it can be damaging, I immediately came to mind. I was in session a few years ago and someone's phone rang, and it was this music that immediately we went from relaxed to like, you could
Yes.
barely even keep it together. I was like, no wonder this client is experiencing anxiety. It's that
That
ringtone.
ringtone. It's so true. And like those responses are just our own conditioned responses. And I think too, for therapists who are not necessarily music therapists, one of the like surefire ways to go when you're using music is using client preferred music. Is like finding out what that client likes to listen to. Who do they listen to it with? It can be a great information gathering tool
Yeah.
of, what are some of your favorite songs? Who did you listen to those songs with, or who did you first hear that song with? I again think of Frozen and
Yeah.
that I love this song and I went with my sister to see it and it's really important to me. And then you kind of gather some of those important moments
Mhm.
through music and what it means to those clients. But there's a lot of research in music therapy about client preferred music and how powerful it is for engagement and change throughout the therapeutic relationship.
Yeah, and I read an article, and I'm wondering if you have experience or knowledge about this. You said you worked with some of the end of life
Yeah.
work.
Mm-hmm.
In this article, I read it a long time ago, so I don't have all the pieces still fresh in my mind. But listening to music for patients that were experiencing dementia, they would play music, and the music was about at their adolescent stage, whatever song they have
Mm-hmm.
or songs that may have been present at that time of that person's specific stage of adolescence, and it would kind of bring them back to the present, and they would
Yeah.
be able to connect momentarily. It wasn't any long changing from what I remember, but their
Mm-hmm.
family members and people were able to talk to them. I mean,
Yes. Yes.
incredible.
It is. I get chills even thinking about
Yeah,
it with,
makes me wanna cry.
yeah, it's that's like um, our brain, especially with Alzheimer's and dementia, I guess the research has shown that when you're losing memories, it's from the outside in. So it's like the newest memories go first, and then your oldest memories stay the longest.
Mm,
So I know a lot of therapists who work in geriatric care will utilize songs and still find out like the client preference, whether they liked swing music or jazz or pop, or, maybe they were like totally quirky and were like, no, 80s music is my absolute favorite, so you never know. But that music that they, felt deeply for whatever reason, that connection just stays. It's still there. And then there's research with the brain that when you listen to music or you're engaged in music, it uses your whole brain. There's not a music center, so it just like lights up so many different parts of your brain.
that's incredible. I'm
Yeah.
an EMDR therapist, like trauma therapist, and I know music, a lot of times we'll use that for our target,
Yeah.
especially taps.
Yes.
And of course, I'm not a music therapist. I wish I was, but that
Yeah.
takes a lot of talent too. I think. So I just pull it up on YouTube, or with the
Mhm.
adolescents, I will pull up their song of choice, and it's
Mhm.
incredible what you can just get at that level. But I think we're talking
Yes.
about music therapy, what you do, it,
Yeah.
it's just hard to even imagine, hard to conceptualize the power of
It is one of those things that I think is best explained by seeing it. It's
it.
if like getting a chance to co-treat or just witness, and I think it's similar with, I feel the same way with play, from when I started learning about play therapy. But then I saw play therapy and it was like, whoa, I see what's happening. Like you can experience it so differently from observing it.
Yeah, it's like you really can't describe it in words
Yeah.
enough to really realize just how profound it can be.
Yes.
Now, give us an idea of what your work actually looks like. Like I'm envisioning you
Sure.
playing like the guitar or singing,
Hmm.
or
Hmm.
what does a day in your life at work?
Well, I'm sure you guys can totally relate. It's always different
Yeah,
depending on the
absolutely.
client. But what we're required to be proficient in is singing, guitar, and piano. So, because they're easy to accompany yourself with.
Mhm.
Your voice is incredibly portable. I do like in-home therapy, so I can't drag a piano around, but I'll bring like my ukulele or the guitar. And so depending on a client's goal, for example, if I'm working with a client who is maybe an end of life client, or a client who has medical trauma and is processing end of life care, we might do something, and depending on their preference and their different abilities, we might do something like songwriting. And then that would look like us maybe sitting down at a table, pulling some different songs we like, highlighting phrases or words that you like from different songs and putting them together in a theme. And then, depending on the client too, sometimes clients are like, I want to figure out the music to this. And they plunk something out on the piano and we use it, we go with it. And then sometimes it's like, I just want to sing. So then I'll, on the back end, come up with some type of way to accompany the song. But through that, the target is emotional processing,
Mm.
finding, oh, this phrase really stuck out to you. What does that phrase mean? It's, I keep getting hurt over and over is the phrase that stuck out for you.
Mm.
What does that mean for you? And, why does it stick out more than some of the other ones? So that would be like
Wow.
a highly verbal session, because on the other end, I do work with a lot of clients who might be nonverbal, who may have profound developmental differences. And that can be doing lots of instrument playing, playing preferred music and seeing what kind of responses and what we can get, like we were saying earlier, with those particular chords that you can add to add tension, how the client responds to that, if they make eye contact, if they, play at that time. So it can be very, very different.
Yeah, and what you just described, I mean, I've really been learning a lot about the polyvagal theory and thinking about how that can just help widen the client's window of tolerance. And if they're
Mm-hmm.
nonverbal, you need to get through them through a way, help them, like
Mm-hmm.
help heal parts of their brain or
Yes.
adaptive neural networks and let all that
Yeah,
through music
absolutely.
is an amazing way. Wow.
Yeah, and it feels so powerful too, for especially clients who are nonverbal, to allow them the space to create as if they don't have that limit. We're making music, and however they can make music, and making it a supportive experience for them so that they're successful. And then, giving them that, I guess, that feeling of like accomplishment wherever they are when they need that. And I'm really passionate about always assuming competence and that we don't know what's going on, inside. So making sure that we give those opportunities.
Mhm. Oh my goodness, what
Yeah.
beautiful work.
Yeah.
It sounds like it
I'm
fits
lucky.
right in with your passion and your personality too.
it, it totally does. Yes.
Well, we're almost out of time, but I want to make
Yes.
sure that people know where to find you, where to find your services and your podcast, anything that you have to
Yeah.
offer.
Awesome. My podcast is called Creative Therapy Umbrella, the podcast, and it's on most podcast platforms. I also have a blog that has a lot about music therapy. The podcast is more talking with art, play, dance, drama, all the different creative arts therapies, and just kind of talking like this, where it's just chatting and connecting with each other. But my website goes more into music therapy and different elements of that. And that's creativetherapyumbrella.com. I'm also on Instagram. That's a great way to get a hold of me. And I love talking with people about this stuff. So I encourage anyone who's listening and wants to know more or has any questions, please reach out because I could talk about it all day. And then another really great resource too, if someone is interested in learning more about music therapy, is the AMTA website. It's musictherapy.org, but it's our National Association of Music Therapists, and it's a great way to find somebody if you're looking for a music therapist. They have everyone listed, so you can find someone in your area. It's definitely a great place to get a lot of information.
Oh, wonderful. And
Yeah.
your podcast, I really want to stress that is like amazing.
Awesome.
It's
Thank
really nice
you.
free resource that people can just access and
Yes.
listen to like wherever they're at.
Yes, and that's what I love about podcasts is you can just play them, put them on, and just it makes me feel with doing in-home work when I'm driving, it makes it feel productive where I'm like, ooh, I'm learning. Well, not just driving to another client's house, I get to learn too.
Yeah, yeah, it's incredible in a
Yes.
different way. I remember one lady told me she listened to mine while she was taking a bath. I was like, that's interesting.
I do that all the time. That's like my favorite thing to do is like podcasts and bath time.
Relax
Yep.
and learn at the same
Yes,
time.
totally. Yeah, they're a great way to get free information. That's for sure.
Well, thank you, Kate. I really appreciate this.
Absolutely. Thank you so much for having me.
Take care.
Thank you.